You're watching Food for Thought, a programme from the College of Medicine and ITN Productions. For an update on the work of the college, Robin Ross spoke to its chairman, Dr. Michael Dixon, about the contribution that social prescription and education about healthy eating could make to the health of the nation.
We should all be having a 7 a day. Easier said than done, but the College of Medicine really believes that eating well can change the health of the nation. Now, joining me is Dr. Michael Dixon. You're the chairman of the college. You really want to get away from this pill-popping culture, don't you?
Yes, we're very over-medicalised. The British Medical Journal itself has a campaign against over-medicalisation. And what we've got to do is to start using the non-biomedical assets that are sitting around us, you know, in terms of local people, communities, volunteers and voluntary organisations. That's where social prescribing comes in, offering me as a GP the potential to send a patient to one of my prescribing advisors who can then work out what they want to achieve, what are their hopes and ambitions, what are their challenges, and then provide them a menu of activities, whether it's to combat loneliness or to help them get a job or help them get benefits or help them be fitter, so that they can actually start to become healthier and therefore make the health service more sustainable. Indeed, the Secretary of State himself has said that in future a social prescription should be regarded as seriously as a medical prescription.
And is the NHS embracing social prescribing?
Oh yes, it is in a big way. Certainly from the point of view of planning, it's in the 5-year forward plan, and the most recent implementation plan, there's talk of trying to make it equally accessible to everyone. The plan is to make it accessible to every doctor, every patient within the next 3 years. If you ask me how far we've gone along that plan, well, there's far to go. But we have, I think, 10 or 11 clinical commissioning groups where every doctor, every patient can access a social prescription. It's in more than half of the sustainability and transformation plans. So it's there, if you like, in hopefully a hope way. Will it happen? Well, that's my job as national lead to make it happen. And I think the College of Medicine is pushing against an open door to see that happen in the next few years.
So what's your mission for the year ahead?
Well, our mission is to extend the work we've been doing so far in food and social prescription. We want to extend our teaching roles. That's to say we have a foundation course. We have 2 this year, probably 3 next year. We're going to be looking at exercise and the physical environment and cancer. So I think we're a bit on the roll at the moment.
How much is diet responsible for bad health, especially compared to something like smoking?
Food is the biggest single factor in our health and in preventing disease. More so than smoking, more so than exercise, more so than anything else. And that's why it's so crucial that we get professionals and the population understanding that, so using food as medicine, as we say. But equally important is the movement that we're trying to establish in the college of trying to bring together the retailers, the producers, the farmers, the food outlets and the experts. And instead of them going in different directions and often being pitted against each other, with the retailer saying to the farmer, we just want more cheap food and we just want it cheap. We need a situation, which we're trying to bring about, where they're talking to each other, where we change the incentive system, and where we actually enable good food to be available for those that need it most.
And of course, the most important question is, do you have your 7 a day?
Yes, I think I am, but I'm growing it myself as well.
You would. Thank you very much.